My name is Dr. Carol Saar. I am a psychiatrist. I have worked primarily in the prison system of New Mexico, although I've also done private practice and outpatient psychiatry. I enjoy looking at the whole picture, and that's the way I approach treating my patients. Because of my traditional psychiatric training, for quite a few years, I used conventional psychiatric medications. But after a while, I became disillusioned with that, both because of the less than optimal treatment results. Depression usually doesn't resolve completely. Many other problems do not resolve completely, at any rate. And there are multiple possible side effects from these psychiatric medications as well. So I started looking elsewhere, hoping that I would find something else that would help people. The first time I heard about daily essential nutrients was at an integrative medicine for mental health convention. It was a few years ago, but the place that I really picked up on daily essential nutrients was when I started a fellowship in integrative psychiatry through the Integrative Psychiatry Institute. They had a handout with several different nutritional supplements that might be helpful, and daily essential nutrients was one of them. And so I decided to give it a try. I was working in the prison system at that time, and we picked 3 patients who were particularly difficult and not really very treatable with their current medications. Nothing was really working very well. And we tried daily essential nutrients on them, and everybody that saw what happened was amazed at the results. The thing that impressed me most about daily essential nutrients in research was that in prison populations, there was significantly decreased violence. My patients using daily essential nutrients, the 3 in the prison that we decided to try them on daily essential nutrients, they experienced decreased anger outbursts, decreased irritability, they smiled more, they had decreased physical problems like tremor. They were more socially engaged. One of our inmates who had committed murders was overheard by one of the officers talking to another inmate, saying he actually felt badly about what he had done. This was astounding to all of us. So the main thing is the better mood control. They're in better control of their behavior, and they interact much more appropriately with other people instead of just acting like other people are not there. There's an appropriate and normal give and take between them and other people. On the daily essential nutrients, we have also noticed that there is decreased self-harm, decreased biting oneself, decreased head banging, and other self-injurious behaviors. My protocol for trying daily essential nutrients with patients is to start slow, is to start low and taper up slowly. Certainly, it depends also on whether the patient is on psychotropic medication, in which case it's important to start more slowly and take into consideration the possible necessity of titrating down on the psychiatric medications that they're on. The 3 patients in the prison, we titrated them up, starting 1 pill 3 times a day and went up by 1 pill 3 times a day every week. So by the end of a month or so, they were on 4 3 times a day. After that point, I would give them a month or 2, all the time monitoring their behavior. And it seemed like after a couple of months that it was appropriate to try decreasing psychiatric medications, and we were indeed able to do that. It takes a while for most patients to notice a lot of difference with daily essential nutrients. It really depends on their diagnosis and how severe their symptoms, how severe their illness is. So some people, you might not see very much happening, maybe a little decrease in depression or a few less anger outbursts, and it seems to take a month or 2 before you see a whole lot of results. The patients on daily essential nutrients, their perception is that they have an increased sense of well-being. They feel less depressed. They enjoy life more and are more socially active and physically active as well. In my experience, the clinical symptoms that the daily essential nutrients help with the most are behavior discontrol, moodiness, and lack of socialization. It improves all of those things just across the board. The daily essential nutrients also help people with irritability, with depression, and with just a general sense of well-being. I would like to see daily essential nutrients offered as one of the first-line treatments for anybody that has a mental health issue who is in the prison system. The reason I say that is because I have seen daily essential nutrients markedly decrease violence, decrease behavior discontrol, decrease depression, improve sleep. And by the way, sleep in the prison is a very difficult proposition for these people. The lights are on all the time. There's always noise. There are people yelling. It's very difficult to get a good night's sleep. So it's important to give that to them as much as possible. Most of the prisoners do not have good nutrition before they ever got to the prison system, because often they're in a lower socioeconomic class, so they haven't had good nutrition. They have suffered from post-traumatic stress disorder, most of them, which even if they're not physically abused, PTSD can cause chemical and structural changes in the brain, which contribute to their misbehavior, and they're ending up being in the prison system. The majority, I bet at least 90% of the patients that I've interviewed in the prison system have a history of at least 1 or more head injuries that no one has attempted to treat, and because they have poor nutrition, it's not going to get treated. Most of them have done drugs. Many of them have had anoxic injuries because of trying to hang themselves. A good share of the people in the prison system have attention deficit hyperactivity disorder. And daily essential nutrients is good for addressing all of those issues. I think that in the end, if a cost analysis could be done, that it would cost the state and other whoever is involved in keeping prisoners in prison, it would cost them less money in the long run if these inmates had something like daily essential nutrients, good nutrition first, before trying psychiatric medications, which often can be very expensive. It's a better treatment anyway because so many of them have nutritional deficiencies. So it's actually addressing the root cause of why they have the psychiatric issue to begin with. It won't address it for everyone, but it would help, I do believe, immensely and decrease dangerousness in the prison system, both for the inmates and for the people that work there.